5. Clinical. Affective. One of the three major categories or domains of learning includes behaviors guided by feelings and emotions that are influenced by an individual's interests, attitudes, values, and beliefs. Assist. Activities in clinical that aid or support the performance of radiographic procedures and therapeutic treatments. Clinical. Procedures and activities that occur in outpatient and inpatient healthcare settings. Clinical coordinator. Program official responsible for coordinating clinical education and evaluation of its effectiveness. Clinical instructor. Program official responsible for clinical instruction, supervision, and evaluation of students in the clinical setting. Clinical staff. Healthcare professionals employed in the clinical setting where students participate in clinical education and provide clinical supervision and guidance. Cognitive. One of the three major categories or domains of learning includes various levels of thought, such as knowledge, understanding, reason, and judgment. Competency. Observable and documented successful achievement of performance objectives. Didactic. Informational and instructional activities that may occur in formal or informal settings, typically in the classroom, laboratory, or online. Direct supervision. Oversight of clinical procedures or treatment by a qualified professional present in the exam or treatment room with the student. Indirect supervision. Oversight of clinical procedures by a qualified professional immediately available to the student. Interprofessional education, IPE. An approach to teaching students and healthcare workers where students or members of two or more professions learn with, from, and about each other to improve collaboration and the quality of patient care. Learning outcomes. Program-level measurable expectations for student learning. Objectives. Topical concise descriptions of an observable behavior to be achieved by students as a result of their educational experiences within a course or educational module. Observe. Activities in clinical where students watch and listen to the performance of radiographic procedures and therapeutic treatments. Program director. Program official that provides leadership for the program and ensures program effectiveness. Perform. Activities in clinical where students complete radiographic procedures and therapeutic treatments with appropriate supervision of a qualified professional. Psychomotor. One of the three major categories or domains of learning includes behaviors involving physical actions, neuromuscular manipulations, and coordination. SBAR, situation, background, assessment, recommendation. A communication method used to assure an effective handoff of patients from one healthcare worker to another. Team STEPPS, team strategies and tools to enhance performance and patient safety. An evidence-based teamwork system that is used in many healthcare institutions to improve the quality, safety, and efficiency of healthcare. Transfer of learning. Learning in one context and applying it to another. The clinical setting allows the student to integrate the knowledge gained from didactic courses into clinical practice. Hospitals, clinics, specialty imaging centers, orthopedic centers, surgical centers, and cancer centers are just a few of the locations that fulfill this need. Competency-based clinical education is based on professional practice standards defined by professional associations, and competency requirements are defined by accrediting and certifying agencies. The American Society of Radiologic Technologists, ASRT, is the professional organization that provides a curriculum. The ASRT also establishes the practice standards for radiologic and imaging science professions. The Joint Review Committee on Education in Radiologic Technology, JRCERT, is the programmatic accrediting body that establishes supervision and safety standards for student participation in clinical education. The American Registry of Radiologic Technologists, IRRT, is the professional certifying agency that identifies the minimum educational and clinical competency requirements for certification. The ARRT standards of ethics reflect the rules and standards that govern the conduct of professional technologists who hold current or former registration from the ARRT, and persons applying for examination and certification by the ARRT. In radiography, procedural competencies for imaging of the chest and thorax, musculoskeletal system, and trauma, cranium, spine and pelvis, abdomen, fluoroscopic studies, surgical and mobile studies, and pediatrics are required. In radiation therapy, the skills required include quality control procedures, simulation procedures, dosimetry, treatment accessory devices, participatory procedures, and radiation treatment procedures. In both disciplines, competence in general patient care skills, such as cardiopulmonary resuscitation, CPR, vital signs, sterile and medical aseptic technique, venipuncture, patient transfer, and care of patient medical equipment, are required. Transfer of learning entails learning in one context and applying it to another. The principle of transfer of learning is exemplified in the clinical education component. The cognitive domain includes behaviors requiring various levels of thought, knowledge, understanding, reason, and judgment. The psychomotor domain includes behaviors involving physical actions, neuromuscular manipulations, and coordination. The affective domain includes behaviors guided by feelings and emotions that are influenced by an individual's interests, attitudes, values, and beliefs. A learning objective is a concise description of an observable behavior achieved by students, which is relevant to a specific topic within a course or educational module. Objectives must be measurable and achievable. They describe what behavior the student is to display, how well the student is to perform the behavior, and under what circumstances the behavior is to be achieved. Closely related to performance objectives is competency, the observable, successful achievement of the performance objectives. Competencies must be documented and competence must be maintained by the student. Learning outcomes, assessed at the program level, are measurable expectations for student learning. Learning outcomes are components of a program's assessment plan, which are used to document the effectiveness of the program. The laboratory setting serves as a bridge to connect classroom with clinical activities. The program officials who assist in the clinical education of the student are the program director, the clinical coordinator, the clinical instructor, and the clinical staff. The program director works full-time in organizing, administering, and assessing the radiography program. This person is responsible for the didactic and clinical effectiveness of the program. The clinical coordinator works closely with the program director in ensuring program effectiveness through a regular schedule of coordination, instruction, and evaluation. The clinical instructor works directly with the student in the clinical setting. The clinical staff are employees of the healthcare institution and provide student supervision and guidance. Knowledge of MRI safety processes prevents both patients and healthcare workers from being injured by the impact of the strong magnetic fields used for MRI. Different zones, or areas around the magnet, are designated by the strength of the magnetic field. These zones are numbered from 1 through 4, where Zone 4 has the greatest magnetic field strength. All healthcare workers who come near the MRI unit or work within the MRI suites must be knowledgeable of the safety precautions to be taken. Clinical experiences include direct patient contact, which requires communication, verbal and nonverbal, and touch. Patients may be of different cultures, socioeconomic levels, age, race, ethnicity, ability, sexual orientation, etc. As such, all patients must be cared for in a unique manner. During these times, students should consider the importance of patient confidentiality and refrain from violating Health Insurance Portability and Accountability Act, HIPAA, standards. The initial stage of clinical education involves extensive observation. This tapers off as the new student gains confidence and can effectively integrate the appropriate cognitive, psychomotor, and affective behaviors. When the student feels confident, they can then proceed to assistance. The student is now gaining hands-on experience. Questions and discussion about the procedure should not be conducted in the presence of the patient. The student develops confidence and proceeds to the performance of the entire procedure or treatment independently and with appropriate supervision. Students should be supervised at all times while in the clinical setting. Until a radiography student achieves and documents competency in any given procedure, all clinical procedures are carried out under the direct supervision of a qualified radiographer. The parameters of direct supervision require that the qualified radiographer, 1. Review the request for examination in relation to the student's achievement, 2. Evaluate the condition of the patient in relation to the student's knowledge, 3. Be physically present during the conduct of the procedure, and 4. Review and approve the procedure and/or image. The parameters of indirect supervision require that the qualified radiographer reviews, evaluates, and approves the procedure as for direct supervision, and is immediately available to assist students regardless of the level of student achievement. Indirect supervision is not permitted for radiation therapy students. Numerous cognitive, psychomotor, and affective behaviors are involved in performing a diagnostic or therapeutic procedure, including the following. Assessing the request. Preparing the room for performance of the procedure or treatment. Caring for the needs of the patient. Communicating with the patient. Performing the procedure or treatment. Providing radiation protection. Manipulating the exposure factors or settings for the treatment plan. Evaluating the medical image or ensuring the appropriate treatment. Manipulating specialized equipment. Appropriately discharging the patient. These behaviors are assessed through the use of direct, objective observation and are documented via rating scales, checklists, critical incident forms, and anecdotal notes. Affective behaviors involving attitudes and values are also among those considered. The student will routinely receive feedback and constructive criticism. All parties involved in clinical education must understand and abide by policies established by both the program and the clinical site. Policies typically involve radiation safety and pregnancy, attendance requirements, professional appearance and behavior, drug and alcohol, infection control, non-discrimination, social media, HIPAA patient confidentiality, supervision, immunizations, and electronic devices. Healthcare institutions use different approaches to assure patient safety. One such approach is team strategies and tools to enhance performance and patient safety, Team STEPPS. The 5 key principles to Team STEPPS include team structure coupled with skills in communication, leadership, situation monitoring, and mutual support. One example of a communication method used to assure an effective handoff of patients from one healthcare worker to the other is SBAR, situation, background, assessment, and recommendation. Steps in SBAR. Situation. What is the situation? Background. What is the clinical background? Assessment. What is the problem? Recommendation. What do I recommend request be done? S. A chest X-ray has been ordered for Bertha Smith. B. Bertha Smith is a 56-year-old with congestive heart failure and multiple emergency department visits. She looks pale and diaphoretic. Her BP, blood pressure, is 90/65 verified with a manual cuff. Her pulse is 110. We've got her on O2, oxygen. A. I think she may be having an MI, myocardial infarction, heart attack. R. Bertha needs a chest X-ray stat, immediately. Is a mobile X-ray in order due to the severity of her condition? Interprofessional education, IPE, is one approach to teaching students and healthcare workers how to interact and work with each other in the clinical setting. IPE allows for healthcare and social care workers or students, from 2 or more professions, to engage in learning with, from, and about each other.